Welcome to our podcast. Today, we're going to introduce who we are and let you know what we're all about. I am Dr. Delaina Wardlaw. I'm a board-certified family medicine physician, and I am one half of the Twin Sister Docs. And I am Dr. Elena McDonald, board-certified general pediatrician, and I am the other half of Twin Sister Docs. Twin Sister Docs. Why is it Twin Sister Docs, Dr. McDonald? Well, we're sisters, we're twins, and we're physicians, hence the name Twin Sister Docs. Our mission is wrapped around helping people be able to navigate the healthcare system, which can sometimes be quite complicated, in addition to helping people live their healthiest, best lives. Yes, because as we know, some people are living their best life, but it's not the healthiest life. So we want to ensure that everyone is doing both. So today, who are the Twin Sister Docs? Dr. McDonald. Why was Twin Sister Docs born? Twin Sister Docs really was born out of a couple things. One, people would always come up to us and say, can I ask you a question? I don't feel comfortable talking to my doctor. And we would always say, that's a problem. You should be comfortable talking to your doctor. We started to realize that we had a bigger reach. We needed to reach more people outside of our offices. We wanted to reach people in our communities, regionally, nationally, to make sure that people had the information they needed to live their best lives. Dr. McDonald and I, we also realized that we are in a unique position as African-American physicians who grew up in the city of Philadelphia, coming from humble beginnings. We have a connection to the communities that we serve. We have collectively been serving the communities of Philadelphia, many marginalized communities, for over 50 years collectively. And so we have a connection where the community feels like they know us and feels like they can come up to us and ask us questions. And we are more than happy to provide patients or individuals with general basic information so they can have a conversation with their doctors, physicians, healthcare providers, anyone involved in the healthcare system, the healthcare field, so that they can get the information that they need to live their best lives. Absolutely. And for lack of a better word, we have street cred when it comes to healthcare. We are from the community. We understand the community. So when we talk to people, people will listen to us. And Twin Sister Docs' mission is based off of 3 T's: trust, translate, transform. Dr. McDonald, tell me a little bit about that. Trust. We are trusted messengers. We are trusted messengers providing accurate medical information in a culturally competent manner. Translate, Dr. Wardlaw. Translate, meaning once you have that information, that can translate into you becoming an advocate in your healthcare so that you can become an active member of the team. Because the team can't just work with just the physician giving all the information. It only works if the patient and the physician are working together so that you can have a better outcome for whatever is being treated or for prevention of conditions and diseases. So translation into transformational outcomes. We are looking to have transformational outcomes in our communities, and that is how we have a bigger impact on healthcare. So there we are. Trust, translate, transform, your 3 T's. Absolutely. Our mission evolves around us also making sure that we leave medicine in a better state than it was when we entered the field many years ago. Yes. We do know that there is a lack of diversity in healthcare. We do know that as African-American physicians, you and I only represent 2% of the practicing physicians in the United States as African-American females. We need to change that. Absolutely. So do you know that recent studies have shown that when African-American patients have African-American physicians in their community, they live a longer life. They have better outcomes. They live a longer life. So we have to make sure that we are fostering the next generation of physicians. Yes. And so it is good for Dr. McDonald and I to be able to go out and mentor young students. We're first-generation physicians. We're the first-generation physicians. We're the first physicians in our family, and we're still the only physicians in our family. And we had to rely heavily on mentorship, Dr. McDonald. We did not have that roadmap that was already given to us when we were trying to learn what we needed to do to get into medical school what we needed to do to stay in medical school, and what we need to do now as practicing physicians, because as doctors, we're continual students. Medicine changes, and we have to keep up with the changes. So we can't say, Dr. McDonald, that's it. Our books are closed. We never have to look at another book again. And so we rely on mentorship today as well as practicing physicians. Many years we've been in practice, we still rely on mentorship. So our job is to make sure, part of our job is to make sure that we get back to the community, make sure that we introduce not only medical careers, but science and STEM careers to the younger generation so they know they can be in this position as well.
Yes. And we want to meet people where they are. One of our main goals is to meet people where they are. So whether it's not, we're going into schools, we're going to community events, we're going to churches, we're going to local radio shows. We want to make sure that we are meeting individuals where they are so that they have the information that they need.
Yep. And we also meet the younger generation on social media. We know how important that is as well. And so we meet you where you are.
Yes. So Dr. Wardlaw, Twin Sister Docs, one of our main goals is to make sure that we are increasing awareness of healthcare disparities and making sure that we are closing that gap. So all the things that we do, including this podcast, is to help individuals, all individuals, and particularly those who have felt unseen and unheard in the healthcare system, have a voice for themselves.
Yep. And that's what we do. We do it on many platforms, here on our podcast, also on Facebook, Instagram, Threads, Twitter. So we're meeting folks where they are. And here we are today.
Twin Sisters Docs, this is who we are and this is what we do.
Dr. McDonald, many times people approach us and ask us, how did we get to where we are? How did we get to become medical doctors? And it's a journey, of course, that it's a journey, to say the least.
Definitely a journey, a long, hard journey, but a journey that's well worth it.
Absolutely. And Dr. McDonald and I, we are Philadelphia natives, born and raised, and we went to all Philadelphia public schools. We graduated from the Central High School, class of 251. And I have got to tell you, our time at Central High School was a great experience and allowed us to not only leave with a great academic education, but it also opened us up to a network. We see Central Lancers everywhere we go. Locally, nationally, we put on that Lancer shirt, somebody's going to yell out a 3-digit number, and we know instantly that we're talking to another Centralite. Yeah, absolutely.
But we met some of our closest friends at Central High School. So Central left an indelible mark on both of us as we move forward through college and through medical school.
And absolutely. And many of our doctor colleagues graduated with us from Central as well.
Yes.
And our class as well. So again, we still have that network. And so public school, our parents made it their mission to make sure that we were able to get into the best public schools that were available to us. They could not afford to send us to private schools, but they made sure we got to the best schools, the best public schools. From there, we transitioned to Temple University. We are Temple Owls, TU, Temple made, Temple proud. And so as we transitioned to Temple University, again, we had to make sure that we were being introduced to a network that was going to help us get out of Temple in a timely manner, because we knew we had to do 4 years of undergrad and then additional 4 years of medical school. So we had to make sure that we were doing what we need to get the work done,
right,
and get out of there in a timely manner.
And I think there was an aha moment for both of us at Temple University. And it was after our freshman year at Temple University. And we got summer internships with a pharmaceutical company. And really, with pharmaceutical company, we're going to get paid. It's going to be a good summer. But that pharmaceutical company they were paying us. However, we were paired with African-American physicians through the Medical Society of Eastern Pennsylvania, which we are part of now. And we shadowed them for 8 weeks throughout the summer. And that experience was life-changing. 8 weeks. Every week I was either shadowing a pediatrician, a vascular surgeon, a neurosurgeon, a cardiologist, an ophthalmologist, a dermatologist. They were all African-American, taking care of are citizens in the city of Philadelphia. And at that moment, I realized if they could do it, then I certainly could do it. So that was one of the most important times in my life as I was trying to navigate if I really was going to go into medicine or if I wasn't going to go into medicine.
And some people know that they're going to be physicians from early on. You heard people say, well, I knew I was going to be a doctor since I was 8 years old. That wasn't my case. For me, I thought I was going to be an elementary school teacher, and I'm grateful and I'm thankful for all the educators on this earth because it is a meaningful, one of the most dedicated jobs that one can have, and it is one of the most necessary jobs. Again, there wouldn't even be physicians.
We would not be sitting here if it wasn't for every teacher who poured into us, every teacher, every professor, every teaching assistant, every tutor who poured into us to make sure we got it the things we received, the things we needed to become physicians. And that's just not for physicians, that's for every industry. So can't be where we are without our teachers.
And so I say to all the teachers, all the administrators, anybody who works in the school with our children, thank you. We appreciate you.
Absolutely.
And I also say to that we remember all of our teachers because they had such a profound impact on us. Dr. McDonald and I, we had a great educational experience, and every child should have a great educational experience. And we are still in touch with some of our teachers today. And so, again, quality education was key for us. That mentorship, when we joined that internship program, one of our mentors, Dr. Wilfreda Ball, still our mentor till this day. Nearly 30 years later, Dr. Ball is still someone that we could talk to. We see her at the Medical Society of Eastern Pennsylvania meetings. So again, our goal now is to make sure that we're giving back because people poured into us, and we make sure that we have to pour back into those who are coming behind us because, as Dr. McDonald always says, you have next. We can't do this forever, so we got to make sure the next generation is coming up behind us.
No, I say you got next.
Okay, absolutely. And so again, our journey is, and it's still a journey. Again, medicine, being a physician is a lifelong career until you retire. And sometimes they even call you back after you retire. Some docs said we're called back out of retirement when we went into the COVID pandemic. So these, it's ongoing, and we just want to make sure that people recognize that there are physicians that look like them from their communities who are dedicated to serving them, and that is the part of the Twin Sister Doc's mission. Absolutely. So as we discussed, the journey to become a physician is a long journey, and so after we journeyed through Temple University, our next stop was
Penn State University. So we are Nittany Lions also. So we're Proud Owls and Nittany Lions. And Penn State Medical School is located in Hershey. And it was very important. Dr. Wardlaw and I actually showed up to medical school together. We had gotten to medical school together. But when we got there, we realized that twins getting into medical school, the same medical school, wasn't as easy as we thought it was. So we had about 2 or 3 other people in our class whose twin was elsewhere. They had gone to a different medical school because they weren't able to get into the same medical school. But medical school was definitely a journey, and it was definitely some long, long days, long nights, and we really had to sacrifice a lot of time, be very disciplined to get through medical school. But again, that's the journey that we were on. We decided that we wanted to become physicians, so it was very important for us to make sure that we did the things that we needed to do to graduate medical school. Medical school was a time of a lot of self-reflection when you had a lot of sleepless nights getting ready for exams. You were in the anatomy lab for 5 hours every day. You only had a couple of hours of break after class. It was very stressful, but again, we had our eye on the prize and we knew the end goal. So those sacrifices, we really knew that was something we had to do, but we also found a fine balance. Once we got to medical school and we realized that we'd be in class for 8 hours a day, then we'd be studying another 5-6 hours. So yes, you do the math. We spent a lot of time in class, a lot of time studying, but we also realized that we couldn't just do that. We had to, 1, socialize with our classmates, which we did. But also, 2, sometimes we needed a break from medical school altogether. And with us being in Hershey, it was very easy for us to travel back home
on the weekends where nobody was talking about medicine. No one was talking about medical school. No one was worried about the anatomy test that was coming up. So it gave us a balance to come home and see our family members, our significant others, our future husbands. Dr. Wardlaw's husband, she was married at the time we went to medical school. So it was important for us to have that balance in order for us to keep going. And medical school also was a time where we really figured out what we wanted to do. I went into medical school thinking I wanted to become a pediatrician. I came out of medical school and I still wanted to be a pediatrician. But I was exposed to surgery, I was exposed to internal medicine, I was exposed to psychiatry, family medicine, obstetrics and gynecology, dermatology. We were exposed to all different facets of medicine, and we were able to make sure that this is, okay, I've seen surgery, not a surgeon. So I love kids, so I'm going to stay on the path to take care of kids because that's where I know that I can make the biggest difference.
Yeah.
And one thing about medical school that we had to learn very quickly, time management was key, absolutely key. And being able to prioritize what you had to do next, because it was rare that you had everything done at one time in medical school. And that was really a precursor to going into our residency training and as physicians now, because again, it's about time management and prioritizing what your to-do list is and what has to be done urgently, what has to be done not as quickly, and what could be done the next day or so. So again, my list is different. My list is like yours, but I think of it differently. What do I need to do right now? What can I do by the end of the day? What can I do by the end of the week? Absolutely. So that is how we prioritize, and that is how we get through the day. Absolutely. And Dr. McDonald, pediatrician, she takes care of babies. I'm a family medicine physician. I can take care of anyone. I can start from age 0 and go up to age 120. Well, that's a little bit, extreme, but you can go to 105. You get the point. So, and I treat multiple generations of families on any given day. I could see 4 generations from one family. And that also allows us to be able to sometimes address some of the other non-medical issues that are occurring in a family that can be having an impact on one's health. So I enjoy being a family medicine physician. I became a family medicine physician because I wanted to have a direct impact on not only treating people when they're sick, but also helping them to stay healthy. Preventive medicine is a significant reason why I went into family medicine. For those of you who don't know, Dr. McDonald and I, we lost our maternal grandmother at the age of 53 to breast cancer. Well, we've already told you that Dr. McDonald and I have been practicing medicine collectively for over 50 years. So again, our grandmother died at a very young age. And so that was a big part of our why as to why we went into primary care, so that we can help people learn about preventive medicine, meaning that we are doing studies before or doing tests before symptoms develop so that we can detect things early. And when I decided I wanted to be a physician, I didn't know all those specific things about medicine. I just wanted to know that I wanted people to live longer because my grandmother died at such a young age.
Right. And for me, I wanted to take care of children. I felt that I could have the biggest impact on not only taking care of children, but interacting with their families and ultimately impacting communities. So I love children.
Absolutely. And residency training, again, this journey is a journey. It goes. It's like it goes and goes and goes. And this journey is definitely a journey. When you graduate from medical school after 4 years, you transition into residency, which is the training period that physicians have to go through, that all physicians have to go through
to become experts in the field that you're going into. Mm-hmm. So after finishing medical school, we were all MDs. However, now to become a specialist in pediatrics, I needed to go into a pediatric residency so I could learn all about taking care of children. And we call it residency because we spent most of our time in the hospital. So we were living in that hospital multiple days out the month. And that's why we call it residency. And I did my residency at the Great St. Christopher's Hospital for Children in Philadelphia. And that is where I honed my skills to become a pediatrician, to provide great care to our children.
Absolutely. And so residency, as Dr. McDonald said, literally living in the hospital for hours. Sometimes you could be at the hospital for a day and a half. And so things have changed. People have realized that, in order to get a good trainer, you also need to not be sleep deprived as well. So those many laws have come into play now, so that residents don't have to work those grueling hours, unusual hours. But residency is the training ground that all physicians have to go through. And then once you graduate residency, you're finally an attending physician. And then that's when you go out and you are the doctor, you are the physician, and you are making all of the vital decisions. Yes, you're making the final decision. And it is good for us to be able to practice in our communities, but practice in communities that are similar to the ones that we grew up in, making sure that people know that we didn't forget where we came from. Dr. McDonald and I are very dedicated to making sure that we pour back into the communities that were very instrumental into pouring into us.
Right. And it's important for us not just to pour to our specific communities, but every community, especially where we have people who feel like, again, they are not seen, they are not heard. We want to make sure that they have a voice. And when they go into their doctors, they feel comfortable. You should always feel comfortable when you go to see your doctor. There should be a comfort level there where you can tell your doctor anything without feeling judged. As we say, it's a no judgment zone, because we need to know everything in order to give you the best care possible.
And that's the journey. That is the journey. That's the journey that keeps going.
Yes, and the journey also includes, our growing families, includes our children. So we have grown significantly over the last 25 years, 50 plus years collectively, but we have learned from our experiences. We've learned from our patients. We've learned from our children. We've learned from our friends. We've learned from our parents. So we have learned many things along the way. I could definitely sit here and say, I am not the same doctor I was 10 years ago, 15 years ago, 20 years ago, because it's based on the experiences that I have had with my patients and their families that have allowed me to become a better physician.
Dr. McDonald, where are you practicing now? Where are your practices now in the city?
So I have 3 practices in the city of Philadelphia. So I have one in Port Richmond, and that is Mentorship Pediatrics, and I have one in Kensington, that's Pazika Pediatrics, and I have another one in the Northeast Oxford Circuit area called Castor Pediatrics. So I have a lot of patients that are underserved, and I also have a large immigrant population. So I have had to improve my cultural competency to make sure that I am interacting with patients who are coming from all over the world to see me, so I understand where they're coming from, what circumstances they're coming from. Cultures are very different, and I had to make sure that I'm listening to patients, making sure that I'm hearing their concerns, making sure I understand the differences in the cultures to provide them the appropriate care that they need.
Absolutely. Are you taking new patients, Dr. McDonald?
Always taking new patients.
Absolutely. You can look Dr. McDonald up at one of her 3 offices, and she will be glad to take care of your babies.
To the age of 21.
To the age of 21. The age of 21 is where I stopped at. Pass them off to doctors like Dr. Wardlaw. Dr. Wardlaw, tell us where you are. So I returned home to my roots. I'm a part of the Temple University Health System Network. My practice is at 4350 Germantown Avenue. I'm 1 block down from the Wayne Junction train station in Philadelphia. So I am accepting new patients as well. So if you're interested in coming to see me, absolutely, feel free to reach out to my office, and that's where you can find me.
Yes. So again, Twin Sister Docs, our goal is to increase the awareness of healthcare disparities, help to close that gap, help individuals become advocates for themselves, for their children, for their parents, for their friends, and to receive the best healthcare possible. That is who we are. That is what we do.
Absolutely. And let's not forget, our goal is also to leave medicine in a better state than it was before we got here. So increasing that diversity in medication and medicine. Yeah, of course, we should not be a rare, we shouldn't be a rarity. We shouldn't be a zebra. And the good old United States of America. So we'll keep pushing forward. So as you tune into our podcast, We will be discussing a variety of things. We'll be giving health tips. We'll be telling you how to navigate the healthcare system. And if you join into our next episode, we'll be discussing how do you navigate. How do you get the best out of your doctor's visit? Absolutely. How do you get the best out of your doctor's visit? Because again, we want you to be prepared when you go into your doctor's visit and feel like you have all your concerns addressed at your doctor's visit. So stay tuned for our next episode. Okay. I missed you. I missed the 5.